Now to the latest on the coronavirus. 121 University of Washington students have now tested positive for COVID-19 linked to an outbreak on Greek Row. UW says 112 students who live in fraternity houses have tested positive. 9 other students had been in close contact with them. UW Medicine put up a pop-up testing site near Greek Row, which had conducted nearly 1,300 tests as of last weekend. Tomorrow, Washington State's new mask mandate goes into effect, and it comes just as hundreds of experts are putting pressure on the World Health Organization to take a stronger stance on the importance of masks. That's because these scientists say the virus is airborne. King 5's Amity Idrisi joins us now to explain what the scientists have found. And Amity, didn't we already know that the virus was airborne as it's in the air, right?
Absolutely, Mimi. We already know that when you cough and sneeze, the droplets get in the air. But the scientists say the difference is this larger droplets that get in the air and fall quickly, and this smaller droplets that hang in the air and infect people. Now, this doesn't mean the coronavirus is hanging in a cloud and can follow you home, but it does beg the question, are we doing enough to avoid infection? And that is what 239 scientists are asking in this open letter to the WHO. These scientists are from 32 different countries, and they're expected to publish these concerns in that letter, which will be reviewed and published in a scientific journal next week. The World Health Organization has long said that while COVID-19 is transmitted primarily through large respiratory droplets expelled when someone coughs or sneezes, they've also maintained that the best way to avoid getting the virus is to frequently wash your hands. But even the Centers for Disease Control in the United States has stated there is very little evidence that the virus is transmitted by touching. Now, because this open letter has not yet been published, the New York Times interviewed almost 20 scientists and members of the WHO for their story. The majority agreed that the transmission of the disease largely depends on droplet size and airflow. Now, this would have serious implications because it's not only going to confirm that we should all be wearing a mask, but it would mean we need to be wearing one more often and in smaller settings. So it would also mean that hospitals need to take a closer look at their ventilation systems and how healthcare workers protect themselves, meaning they're going to need more than just a medical mask. They're going to need respiratory masks like the N95 mask, for example. Now, the WHO says that they have received this letter and they have their experts reviewing it. Live in Seattle, I'm Amity Idrisi, King 5 News.
Thank you, Amity.